Thank you, Mr. Chairman. Thanks for holding this hearing. Thanks to our witnesses, Senator Domenici, with whom I served for many years on the Budget Committee, and I have deep respect for, and Alice Rivlin, who is a legend. And we appreciate the extraordinary work you've done. I think, frankly, you've got it about right. I served on Bowles-Simpson. In many ways, I think your work product is actually somewhat superior to ours. And I say that because while there are a lot of similarities, you did take on a fundamental reform of Medicare. And my own conclusion is we're going to have to do it. How we do it, that's critically important. We don't need to throw the baby out with the bathwater. We don't need to shred Medicare in order to save it. But we do need to change some of the elements of how it functions in light of healthcare inflation and this gigantic growth in the baby boom generation. These are undeniable facts. The growth of the baby boom generation is not a projection. These people have been born. They're alive today. They're going to be eligible for Social Security and Medicare, and the trustees have told us we're headed for the cliff. So, I mean, any prudent person, I think, would say we're going to have to make some changes. And part of it is going to have to be done on the revenue side as well, because as you point out in your chart, in addition to the chart Senator Domenici referenced that shows Medicare as being the driver on the cost side, you also show on the revenue side that trying to do this with the ordinary level of revenue that we've had, 18% of GDP, is not going to be enough in this context. And that the times we've balanced the budget, we haven't been at 18% of GDP on revenue, we've been at 20% of GDP. Your chart shows that very clearly. I think one other thing that is so important, and it's not been said here today, Director Rivlin, you've indicated that your plan calls for a $2.6 trillion revenue increase, but that is compared to current policy. Current policy. If we would compare your plan to current law, it's actually a tax cut. And it's a tax cut, my calculation is, about $1.6 trillion. So when we use these words, and words matter a lot, and we say there's going to be more revenue, compared to what? Compared to current policy, it's more revenue. Compared to current law, it's less revenue. Isn't that the case?
Yes, it is. Yes, it is the case.
Yes, absolutely.
And you're talking about a revenue level in 2022 of 20.6% of GDP. Is that correct?
I think so.
And that's exactly what the revenue level of the country was in the year 2000.
That's right.
That's exactly what it was. And we balanced the budget, and we quit taking Social Security money to finance the general operations of government. So I think you've got it about right with respect to the revenue side of the equation. I think you've got it. I think you're headed in the right direction on entitlement reform. I've got a little bit of time here left. I'd like to go to the question, one of the great vulnerabilities, obviously, of the Medicare reform that you're proposing is this question of cherry picking. How do we prevent cherry picking by those that offer insurance coverage?
You enforce the rule that they can't do it. You have a regulated exchange with rules. If they're going to offer their wares on the exchange, they have to take all comers and at the same price, and they have to offer what Medicare offers. There are certainly ways of throwing off the exchange anybody who does not abide by those rules. In the early days of Medicare Advantage, there was a lot of cherry picking. But even in Medicare Advantage, the CMS has managed to get rid of that.
Can I just say in conclusion, Mr. Chairman, to me it is one of the biggest challenges we confront in Medicare reform is dealing with this risk of cherry picking. And you're quite right. You do it through regulation, but I think we all know there are geniuses at this country at getting around rules. And that's going to be, I think, one of the biggest tests. I thank the Chair.